Welcome to Same Day Surgery at Shannon Medical Center. As you plan for your upcoming surgery, we want to share an overview on the process to help you know what to expect and how to prepare. We want you and your guests to feel welcome and have a great experience. Our mission at Shannon is to provide exceptional care to our family, friends, and neighbors, and it is our privilege to take care of you. Approximately 5 to 7 days before your scheduled surgery date, one of our pre-admission nurses will call you. During this phone call, they will review your health history and medication list and also discuss what medications you should take and which ones to avoid on the day of your surgery. If you are taking a medication that is not listed in your health records, please let your nurse know. Certain medications taken on or prior to the day of surgery could lead to a delay or even a cancellation of surgery. Be sure to discuss with your doctor and pre-op nurse to confirm when medications should be taken or stopped for surgery. Your pre-admission nurse will also want to know who will be providing your ride to and from the hospital on the day of your surgery. You will need to provide your ride's contact information. It's important to note that our policy requires you to have a responsible adult present before you are discharged. Patients who have received anesthesia are not permitted to drive for a minimum of 24 hours. A parent or legal guardian of a child who is going to have a procedure or sedation must be present in order to proceed, and we must also have proof that they are in fact the legal guardian of the patient. Please bring any paperwork, like legal guardianship or medical power of attorney, on the day of the procedure if it is not already on file. Approximately 24 to 48 hours before the day of your surgery, you will be receiving a phone call from a member of the same-day surgery staff to let you know what time to arrive at the hospital. Please note that your arrival time is not the same time as your surgery start time. These times are subject to change. Your pre-op nurse should give you an estimated procedure start time on the day of your surgery. Your same-day surgery staff member will let you know when you need to stop eating and drinking. It is extremely important to note the times the nurse tells you to stop liquids and solids. Since your safety is a top priority, failure to follow these directions could result in your procedure being postponed or even canceled. Shannon Medical Center offers free valet service available from 5 a.m. to 4:30 p.m. for your convenience. If you choose not to use the valet, there are several reserved parking spots for surgery patients in our main parking lot. All visitors and patients must enter the main hospital through the front entrance. Our front doors will remain locked until 5 a.m. To ensure safety of all staff, visitors, and patients, you will be required to pass through our weapons detectors. As an added measure of security, your belongings may be subject to a brief search. Firearms, knives, pepper spray, and all other weapons are not permitted. Our volunteers will then greet you and direct you to our registration department. All patients must first check in our main registration department located on the first floor. After you have completed your check-in at registration, your account will be activated and you will receive a yellow armband. You will proceed to the same-day surgery unit located on the third floor using the visitor elevators. Your next stop will be the same-day surgery nurses station on the third floor. Our staff will direct you where to go next. If we have pre-assigned you a room, which is usually the case for our first patients of the day, then you will be taken to your pre-op holding room. If we do not yet have your room pre-assigned, you will be asked to wait in one of our designated waiting rooms until your pre-op holding room is ready. Once you arrive to your pre-op holding room, we will get an initial set of vital signs as well as check your weight and height. You will be asked to change into a hospital gown and remove all belongings and jewelry. Only 2 visitors will be permitted in a patient room during the pre-op phase. All other visitors must wait in the waiting room until the pre-op is complete. Afterward, a same-day surgery nurse will enter your room to begin the pre-op phase. Your nurse will ask you a series of questions that typically begins with confirming your name and date of birth, and then confirming what procedure you will have. You will also be asked to provide the times of your last intake of fluids and solids and information on your medication and your health history. IVs are a necessary part of your surgery. Please inform staff of any restrictions you may have regarding lab draws, IV sticks, or blood pressure checks, including having an AV fistula or a history of a mastectomy. Limb alert bracelets may be placed on patients with these restrictions. Your pre-op nurse will provide you and your visitor with your case number and security codes for your procedure. We will try to provide you with an estimated start time during this phase. Occasionally, other Shannon team members may enter your room to participate in your care. These include our lab department, X-ray techs, CT transport, or spinal cord monitoring team. Part of the preparation for your surgery may include having a tech or a nurse prep your skin with a shave or special wipes. You will be visited by your surgeon and your anesthesiologist before going to your operating room. Please feel free to ask them any questions during this time. Your surgeon may mark you with their initials using a skin marker. Jewelry or metal cannot be worn in the operating room. Glasses, contact lenses, dentures, and hearing aids may remain on until right before you go to surgery. A belongings bag will be provided to keep all your belongings together. All belongings will have to remain with your visitor for safekeeping, which is why we encourage bringing as few items as possible. It's extremely important to remember you will not be allowed to eat or drink anything while you are waiting to go to surgery. This means no ice chips, chewing gum, candies, or drinks, including water, even small sips. Again, this is for your safety. Your pre-op holding room is a temporary room that you will be waiting in until your operating room is ready. Once you have gone to surgery, your room will be cleaned and become available for the next patient. After you leave your pre-op room, your visitors may go to the waiting room designated by your pre-op nurse. If you are being admitted to the hospital after surgery, your visitors will wait in the ICU waiting room. If you will be discharged the same day after your procedure, then your visitors will wait in our day surgery waiting room. Please ensure your visitors secure your belongings with them as they leave your room. Once your operating room is ready, your OR circulator nurse will come into your room for a brief interview. They may have you sign your anesthesia consent form. Then it's time to roll to surgery. Your surgeon will update your family once your surgery is complete by locating them in the designated waiting room. It is important that your visitor is available in the correct waiting room for your surgeon to provide an update on your status. After your procedure is complete, you will be transferred to our recovery unit. Visitors are not allowed in the recovery unit and may remain in the waiting room during this time. Recovery typically takes between 45 minutes to 1 hour, but may last longer if waiting for an available room. If you will be admitted after surgery, you will be transferred from the recovery unit to your hospital room. Your visitors will be informed of your room number and location. Once you are in your hospital room, your family is welcome to gather your overnight bag from your vehicle and take it to your new hospital room. If you are having an outpatient procedure, you will be transferred back to same-day surgery from the recovery unit. We will assign you to a new outpatient room. Once you have arrived in your outpatient room, we transfer you from your bed to one of our recliners. We will then offer you a snack and a drink if your surgery allows and begin assessing your vital signs. After you are settled in, your discharge nurse will notify your family of what room to join you in. Usually, you will be in this phase for about 30 to 45 minutes. Your nurse will review discharge instructions and remove your IV. Once your IV is out, your family can assist you in getting dressed. Your designated visitor for transportation may call valet or move your vehicle to the front entrance of the hospital. A member of the same-day surgery staff will take you in a wheelchair out to your parked vehicle. Thank you for choosing Shannon and trusting us with your healthcare needs. We look forward to seeing and caring for you in your upcoming procedure.